Here's a USMLE-style question on non-caseating granulomas, e.g. sarcoidosis. Question: a 35-year-old African-American woman presents to the clinic with progressive shortness of breath and dry cough for the past 3 months. She also reports fatigue and mild joint pain. She denies fever, night sweats, or weight loss. Physical examination reveals bilateral hilar lymphadenopathy on chest X-ray. Laboratory studies show elevated serum calcium and increased angiotensin-converting enzyme ACE levels. A transbronchial lung biopsy reveals non-caseating granulomas composed of tightly clustered epithelioid macrophages and multinucleated giant cells, without central necrosis. Which of the following is the most likely underlying immune mechanism responsible for this patient's disease? A. Delayed hypersensitivity reaction, type 4, with Th1-mediated macrophage activation. Excessive neutrophilic infiltration and tissue destruction. C. Direct cytotoxicity via CD8 plus T cells. D. Complement activation and immune complex deposition. IgE-mediated mast cell degranulation. A. Delayed hypersensitivity reaction, type 4, with Th1-mediated macrophage activation. Explanation: this patient's symptoms, bilateral hilar lymphadenopathy, hypercalcemia, and elevated ACE levels suggest sarcoidosis, a systemic granulomatous disease. Sarcoidosis is mediated by a type 4 hypersensitivity reaction driven by Th1 cells and macrophages, similar to tuberculosis. Unlike TB, sarcoidosis forms non-caseating granulomas, no central necrosis. Macrophages within granulomas produce 1-hydroxylase, leading to excess vitamin D and hypercalcemia. Why the other answers are incorrect. Excessive neutrophilic infiltration and tissue destruction. This occurs in acute bacterial infections, not granulomas. C. Direct cytotoxicity via CD8 plus T cells. CD8 plus T cells attack virus-infected cells, but sarcoidosis is driven by Th1 cells and macrophages. D. Complement activation and immune complex deposition, seen in immune complex diseases, e.g. lupus, post-strep GN, not sarcoidosis. E. IgE-mediated mast cell degranulation. This occurs in type 1 hypersensitivity reactions, like allergic asthma or anaphylaxis, not granulomatous diseases. Key takeaways. Sarcoidosis is a Th1-mediated disease, leading to non-caseating granulomas. Elevated ACE levels and hypercalcemia are characteristic. Bilateral hilar lymphadenopathy is a classic finding on chest X-ray. Would you like more questions on other granulomatous